welcome to Stories from Social Care Leaders, a podcast hosted by the University of Salford, which is dedicated to amplifying the voices of those shaping the future of social care. So in this first series, we'll focus on strategic level perspectives with a kind of key emphasis on social care nursing. We'll be speaking with key figures in the field, discussing topics such as policy, education and research, really to highlight the kind of ideas and experiences driving change. So today we're joined by Professor Claire Pryor, the RCN Foundation Chair in Adult Social Care. So welcome, Claire. Do you want to
Thank
give
you.
us a bit of an introduction to your kind of professional background, maybe?
Yeah, thank you. So, like you said, I'm Claire Pryor. I'm the RCN Foundation Chair or Professor of Adult Social Care Nursing. And I'm a registered adult nurse and have worked in a number of different settings. But the thing for me that always came through as kind of core as I moved around was wanting to understand kind of where people live their lives whilst they're unwell. Um, so I've worked, like I said, in many different settings, including kind of acute medical assessment units, intensive care, but then moved back into the community in intermediate care settings, which involved going and looking after people in their own homes and in residential and nursing care homes. And then worked for a mental health trust in older people's services, supporting people moving from inpatients back into their own homes or back into the wider community. And actually, when I was a student nurse, I had a placement, a really early placement for about 4 weeks in a care home setting in my first year, which I found really inspirational and really helped ground the way that I think you can look after people very, very well in a home-based environment, and worked as a healthcare support worker, a nursing support worker, all the way through my training, and really enjoyed that level of interaction you had with the people I was caring for, whilst looking after their health needs and learning my skills, whilst I was a student nurse and then working as a support worker. But being able to do that in a way where I got to know them as an individual and really be able to apply kind of holistic nursing principles whilst doing the kind of the healthcare intervention, and helping them really live their best lives with whatever support they needed.
Mm.
Um, I came out of clinical practice in 2016 whilst I was doing my PhD research into delirium superimposed on dementia with mental health nurses, and started to work at Northumbria University. And that was a huge shift. I'd thought about it a couple of years before and really didn't want to leave practice at that time. But actually, all I feel that I did was pick up my practice and practice as a nurse in a different setting. It's just a different kind of skill. So I was supporting student nurses through their journey to qualification, which was so fantastic to be able to help have really good conversations with them and shape and grow their skills and put them back into the workforce.
Mm.
And started to lead and support modules around frailty and multimorbidity and really high quality older people's care. And I think one of the things that's really key for me is older people's care specifically. Um, I think is one of the most complicated areas of nursing. You have all of the multimorbidity profiles, all of these different competing body systems, and all of the different intertwining of the anatomy and the physiology and the chemistry. So, kind of that science of what's happening with the body in a social construct where people live, how they engage, loneliness potentially, social isolation and their world, how the world shifts around people, and also the interface between kind of community, social care, home care settings, and hospital settings. So that whole ecosystem is really
Mm.
fascinating how that comes together. I also started teaching on non-medical prescribing, so supporting people in multiple different environments and nursing roles to gain their V300 nursing qualification, with the NMC in independent and supplementary prescribing. So really helping to kind of advance that career workforce. And the job came up to support social care nurses specifically, and to do research and look at professional practice and education around nurses who are registered nurses but happen to work outside of the NHS settings in social care. So that could be nurses working for private companies, it could be nurses working in care homes, it could be nurses working for domiciliary, so home based services, um, who all need their role understanding and the ways in which they work and how the infrastructure and governance happens out with the kind of the traditional NHS settings that we have. So that's the work that I'm
Mm.
doing at the moment, based at Salford University, which is a really lovely hub for all of this activity around social care nursing and social care and well-being in the biggest sense.
Oh, amazing. Yeah, and I think really highlights the kind of rich types of experience you can have in different contexts in nursing, I guess. So your current role, what are the kind of, I guess, what are the key facets to the current role? Why is it important, in your perspective?
So I think for me, we're all on a learning journey, and actually, we've got about 40,000 registered nurses that work across about 18,000 different organisations which aren't NHS based. And those registrants, so the nurses working there, quite often find it difficult, or there's additional complexity with them accessing continuing professional development and really just having their profile seen. They're registered
Mm,
nurses on the NMC register, the same as every other kind of nurse within the UK. But quite often in social media and in campaigns, the imagery of nurse that we see is a very hospital based nurse, quite often in uniform, and very much centered around NHS, which is
mm,
absolutely fine. However, we have a huge workforce that doesn't work within the NHS. And it's about just getting a level playing field and having that parity of esteem to say, actually, nurses can work in multiple different locations, and we have a huge workforce within social care. You might not recognize them visually as nurses because they might not be wearing uniforms
mm,
because of where they work and because of the nature of the role that they're doing. It might not be appropriate for them to wear uniforms, but they are engaged in core nursing activity using that critical mindset that our education as nursing brings to us.
mm,
Um, and it's about celebrating that and really championing, but also supporting them to have kind of equal access and equal opportunities to career promoting and career development. So my role has three key facets. It has research, education, and professional practice. All and those things are inextricably linked. It's all part of one bundle. Um, and I think if over the next 5 years I can do some really good work in each of those three spaces, I'll be able to support the nurses working in social care really well.
Oh, amazing. Thank you. So I know you've been working on a number of different projects since your role started. If we can zoom in on one, on the concept analysis work that you've been doing, I wonder if you could tell us a bit about that, what it looks like, what its purpose is.
Sure, sure. So, one of the things I get asked quite often, and it's one of the key questions I had when I started this role, was what do we mean by social care nursing? Because, like I've said before, it's nursing. It's almost like nursing full stop. You know, all registrants, but there is something unique and there's a unique identity, and there's a big movement around recognizing um, adult social care nursing. So I will speak to kind of the adult bracket, and by that I mean kind of people who are using social care services where a registrant is needed to support their care, that adult nurse or that nurse of any registration, but the people we're serving are 18 plus or moving away from pediatric and children's services up into what are categorized as adult services. So it might be 16, 17-year olds starting that journey. Um, and it's quite hard to define. And I think there's lots of policy and there's lots of agenda. And sometimes we use words and terms without really understanding them. So a concept is kind of, if you think of a concept, it's a mind map, it's a mental formulation that you put together by using lots of different sensory input, lots of different knowledge you have in your back pocket, the world that you see the world, the way that you see the world puts together a picture for you. And there isn't a picture and there isn't really a definition, or there's nothing out there about what we mean by social care nursing, because it seems to be a bit split. You have social care, and if you look at policy and document social care provision from a organizational point of view, is care provided to somebody to help them live well, independent, engaged lives, whatever that might look like for them, and often focuses on personal care, um, emotional well-being, access to resources, potentially financial support, and also care provision to help them lead their best independent or autonomous lives. And then you have nursing, which is includes all of that, but also includes the need for this nurse, the registrant. And it becomes difficult when you try to put those two things together, nursing in adult social care nursing. And I looked at all of the literature and the policy, and that, like I said, there aren't really these definitions, or there's nothing to hang the hat on. So I thought it would be really good to do a formal research study using a really good methodology to pull together both the literature we have around adult social care nursing, but then also hear from nurses and other registrants and people who work in, with, into, or for social care services to gain their understanding and their perspectives about what it means to be an adult social care nurse. So we've
Mm,
done the literature review, and that helped us find some key facets and some key ideas that we think make the building blocks of adult social care nursing. And then I spoke to a lot of different people and heard their voices and their opinions about what they think it means to be a nurse within adult social care. And from that, we've kind of distilled and put the two together, and we're creating a state of the art definition about what adult social care nursing is. And I think the
mm,
important thing there is it's the state of the art now.
mm,
So it's evolutionary. It will change, it will flex as all of our services and government and policy moves, and the professional nursing workforce shifts over the years. As we've seen, it's a fluid, dynamic creature. And
mm,
so we can get an understanding of what it means now and offer a first definition, but it will, if we came back to it in 10 years' time, it's going to have changed. So, as a state of the art for now about what it means to be a nurse in adult social care. And I think that's a really firm foundation for shining the spotlight and raising the profile about the complexity of role that adult social care nurses have, and
mm,
all of the different facets of nursing education, the mindset of nursing, the skills, the professional skills, the business skills, the critical analytical skills that they have, working across multiple different organizations and really having to deal with complexity at every
mm.
level, and really celebrating that real high level of acumen they have around their nursing jobs.
Yeah, it's amazing. I think it really speaks to the value of involving nurses within that
Absolutely.
research,
Hmm.
of their voices shaping it, and kind of directly informing that definition, I guess. So I wondered how you approached those conversations, I guess, whether there was people from different types of roles, whether anything kind of surprised you about maybe those conversations, or any key messages that
Yeah.
came from them.
So you're absolutely right. There's no point me doing any of this work if the nurses themselves aren't involved in it, because my job is to be of service to the nurses. That, there's no point me doing anything if it's not right for them, and if it's not with them, and if it's not for them, and if it's not useful to them. So they were there front and center. So we recruited a lot of nurses and other professionals, and people who work into and with those services. So we had a really well-rounded perspective from all angles to inform it. And it was fantastic. And I think when you talk about strong messages, what often comes through is because the nurses working in social care settings aren't working necessarily within the organization, the structure, the conscious awareness of
Mm.
NHS. They feel potentially othered and sometimes a little bit on the outside, and sometimes, not in all cases, like with everything, but sometimes feel that people don't recognize that they are qualified nurses on the NMC register. They meet the same standards for registration. They've gone through, the intense educational setup that you have to go through to be a registered nurse. And sometimes there is a disconnect of understanding between that and nurses working in other areas. So it's really important for me to be able to support them to be recognized for that. And also people don't appear to understand the complexity and the autonomy that nurses working in social care have, because they don't often have those big layers and support structures around them all the time. You might be the only nurse. You might be
Mm.
the only nurse in the company. You might be the only nurse in the care setting. And in some areas, you don't have the same kind of on-call structure. You don't have um, different resources and teams that you can semi-instantly get your hands on if you need something. You have to be really quite secure in your knowledge, your skills, and your level of autonomy. So I think that's really important to kind of pull through. And that's all fields of nursing. So adult mental health, learning disabilities, and children's nurses. Um, it's across the board, because we social care nursing is quite often seen in that concept. If you you look into your mind's eye and think about, well, what's nursing in social care, the first thing that will come to somebody's head potentially is the care home setting, the nursing home
Mm.
setting. And that is a really important part of it, but it's not the only part of it. We have
Mm.
our nurses working in complex home care. We have nurses working in educational institutions, residential colleges, shared flats, homelessness and inclusion health services. So it's really quite broad. But the mind's eye, the gaze that you have quite often automatically will go to care homes. So there's something about me recognizing that and celebrating it, but also making sure that all of the different areas where nurses work in social care are represented equally, proportionately, and fairly as well.
Yeah, amazing. And like you say, I think really bolsters or gets a good kind of framework at the start of this role to then go on to all those other kind of exciting future projects. So what's the next steps for the concept analysis? I guess where are we at with it? Is it publishing and then sharing it across
Yeah.
different forums? Yeah.
Yeah, so at the moment, we are in the phase where all of the data's been collected, it's been analysed. I have a first tentative working definition, which I'm so excited to share with people. Um, Even if it doesn't seem groundbreaking, it's there and it will be out there in the public domain for people to
Mm.
use and see if it fits with them, and to criticize or to want to add things in. It's that conversation starter and really get, that
Mm.
engaged discussion. Because, like I said, it's the state of the art now, potentially, from what I've heard and what I've read. Changes, it moves on. But I think getting that there out in the public domain. So we are about to submit it for publication. And I think another thing that's really key for me is writing for publication is wonderful, but also we need to have tangible real world materials that are very instantly accessible and usable by lots of different people. So we will be creating either a storyboard about it or some form of digital art to help show the process that we've been through potentially, and what this concept of adult social care is in a visual, creative way. And we have our website at the University of Salford for social care nursing, so it will go up on that in our repository where people can find all of the research that we're doing as a big collective team. So we can share that, freely, widely, and accessibly with everybody.
Yeah, it's really how, I guess, about getting that message across to in different ways to different people, isn't it? Which is yeah,
Absolutely.
which is exciting. So moving past the concept analysis, what else is important to you, I guess, to within the kind of 5-year scope of this project or your
Mhm.
post? What are the kind of key areas in social care are really um critical to you and your kind of interest in tackling, I guess?
Yeah. So I think one of the things for me is unpacking and supporting people with career progression.
Mm,
So we know the traditional kind of developmental process is um, kind of staff nurse or shop floor nurse, and then moving into kind of clinical lead or deputy manager, managerial role, and then into kind of potentially regional or kind of national support roles. But actually, I think there's a huge space for I'm going to say clinical, but I don't just mean technical clinical, but for the advanced practice, specialist practice, person facing, direct kind of care role development as well. So it's fantastic that the NMC have approved quite a few specialist practice qualifications
mm,
um, in the broader community health arena, and then the Queen's Nursing Institute have got field specific standards which can be partnered with that, and then specifically in adult social care nursing. And I think that's really important to give that recognition and that understanding of working in a social care nursing arena has specialist nursing skills. It is an
mm,
NMC recordable qualification, so it's one of very few post registration education setups that leads to an additional annotation on your NMC register. So I think that's fantastic to be able to celebrate that and have our social care nurses go through that pathway. And the same for ACP, getting the advanced clinical practice education set up within adult social care nursing is so important, and that has started. There are ACPs in adult social care nursing, but again, I think they're not seen. I think it's about raising that profile and really getting it visible that you can have, in NHS, you go through kind of nurse practitioner, ACP, specialist nursing, career trajectory. We have exactly the same in adult social care nursing, but it is starting and we're growing it. Whereas we can probably learn really good lessons and take advice and guidance from the history we have of that within the NHS. So we should learn and we should take all of their top tips for how to do it, but then
mm,
recognize the concept of adult social care nursing is different and it is unique, and there are things that may or may not translate, but you can have that same direct patient contact, advanced practitioner career pathway within adult social care nursing. And I think
mm,
one of the doors I am passionate about unlocking, and in the next 5 years, if I get this sorted, I will have fulfilled my promise to myself and to the nursing workforce, is that non-medical prescribing. So another one of the specific NMC annotations, non-medical prescribing is complicated. Getting on the course is complicated. Getting through the course is complicated, but actually using it and operationalizing it within a social care setting is really complicated because of the multiple different governance and work structures that sit around it. But whilst it's complicated, it can be done, and it doesn't have to be so complicated. So one of the projects I'm working on at the moment is unlocking that, laying
mm,
open, laying bare the complications, and then finding really good solutions and almost putting together a roadmap and navigation for people who want to do this within their organizations or for themselves, giving them a toolkit and resources to help ease that journey and show the complexity, but then show the solutions. Um, so we're hosting a world cafe, so kind of a global cafe at Salford University in the next couple of months to bring people with experience and a willingness and a drive and all the key players um, together to look at that. And then
Mm.
hopefully that will inform some research where we can pull this toolkit together, pilot it, put some real world kind of sites together and really see how we can embed the principles that we want to embed to make this journey much, much, much easier for social care nurses and then give them some
Fantastic.
resources back to help them.
It's so exciting to hear about all of these plans coming together. I wonder whether I'm always really conscious that for those students, who those nursing students who are thinking about, where they wanna go in their
Hmm.
careers, as you've kind of said, there's often that default to assume the NHS is the pathway that one will take. What would you say to those students, I guess, who are thinking, "Okay, maybe social care is for me, I kind of wanna see what that could look like for my career." What would be your kind of key message to those students, I guess?
I think for all students, if they've considered social care nursing, if they haven't considered it, if they don't have a clue what social care nursing
Mm,
is, keep an open mind. So when we interview student nurses, the thing that we often hear, we ask them why they want to be nurses, and they tell us their stories and their truth about how they want to care and they want to help people and they have this inner motivation to help support people in whatever way that would be. For me, I realized that I found the body fascinating and I was really into kind of the biology and the chemistry, but the human being that was attached to all of these different organs and body systems. So it can be something quite technical like that. But what happens is they all talk about it with a human lens on it. It's not a removed thing. It's not, I want to be able to do X, Y, and Z job or task. It is the person. So
mm,
they come to the course and then we put them through placements. And quite often, the feedback we get is they're learning all of this wonderful stuff, but they want more time and they want to be able to know the person as an individual, or they want to be able to know them as an individual within the time they've got with them. And sometimes we see them get quite disheartened that they're not able to do that because environments are really fast paced or it doesn't have the infrastructure and the setup. If that's your thought process as a student, that you're finding it a little bit hard to reconcile what you thought nursing was going to look like and what it is whilst you're going through your training, ask for an adult social care placement because
mm,
you will get that really well rounded grounding in absolute key NMC standards for placements. You will be able to meet your Annex A and B proficiencies for your standards for pre-registration nursing. It's absolutely, core registrant education. But you will get to understand that person as a human being, whether that's someone you're going to look after for 4 weeks or whether you're in an adult social care nursing service where you see them for 45 minutes. You will see a different level of holistic ethos coming through, um, which is really satisfying to be able to do
mm,
the tracheostomy care, to be able to do the respiratory suction. You will be doing parenteral nutrition management. You will be supporting catheter care and really complex wound care. So, all of those kind of proficiencies. But you will be getting advanced communication skills. You will be getting really in depth, holistic nursing skills, really, really fine tune your care plan writing skills so you will get the total package. So I would
mm.
say just suspend any thought process about what you think adult social care nursing is. Be brave, go and have a go. It will change the way you think about nursing.
So is there anything else, Claire, that we've not touched on that you wanted to, get across, or any other messages that were kind of important to you before we
I
close
think it's
today?
about just everybody having open open minds.
Mm,
Um, Nursing is hard and nursing is complex, and nursing happens in so many different fields with so many different flavors and so many different people feeding into it. And it's about seeing it, how we support everybody in a total workforce for the
mm.
health and well-being of everybody, irrespective of where that care is being delivered, I think. And really being open and engaged to work with lots of different organizations in lots of different ways.
Amazing, that collaboration. Love
Absolutely.
it, thanks so much. So as Claire said, the University of Salford website will be housing all of the exciting concept analysis work and all of the future work that Claire and the team are doing at Salford. Um, but yeah, thanks so much. Is there any kind of contact details where people should go to contact you? I don't know if you're on any social media.
Yep. So
Oh,
I am currently on X, so you can find me at Professor Claire Pryor, and I am migrating over to Blue Sky. Um, so you can find me on both of those. But I would say the main one is the University of Salford social care website. And I know the link is on this page for you to be able to go and have a look at.
indeed, thank you so much.